Did you know 1 in 3 Americans who have diabetes have issues with low blood sugars? And low blood sugar can be dangerous. I had no idea until I had a conversation with my healthcare team. I found out that taking care of low blood sugars is a shared responsibility. There are a lot of options, and you can prevent low blood sugars.
Hi, Jim. What brings you in today?
Well, Claire, I thought I should let you know that I'm having more low blood sugars and less warning signs, and I'm getting concerned. When they happen, I feel shaky, but more often I just get confused. I can't go on like this. I've tried to adjust, but nothing's working.
Well, I'm glad you came in. We've got to figure out what's going on here. There are a lot of things that can cause low blood sugars. Have you lost weight or changed your diet or become more active?
No, that's the thing. I'm doing the best I can, but I can't keep my numbers under control anymore. I used to think having low glucose was a part of living with diabetes, but now the episodes are coming more often and I'm having less warning. I'm scared.
Don't worry, Jim. We've got lots of options to talk about, but we've got to figure out what's going to work best for you. We believe that the patient's values and preferences should always be considered, and we really want to hear your thoughts on setting your blood sugar goals and how to keep you from being too low.
Okay.
Dr. Davis will be right in.
Hey, Jim, I hear you're having more low blood sugars. Tell me about that.
Well, like I told Claire, the episodes are coming on faster and more frequently with less warning signs. I hope there's something we can do. My family's concerned that it's a warning sign that something more serious is going to happen during one of these episodes.
You and your family are right, Jim. Low blood sugars are dangerous. I'd like your help to figure out our next steps. Everyone's different, and we need to learn more about what's going on in your life so we can figure out what the best options are for you.
So there's more to it than just insulin?
Changing your insulin might be one option. We need to figure out what's causing the low blood sugar levels. Food, activity, drinking alcohol, or other health conditions can increase your risk too. And we need to learn more about you and your lifestyle to help narrow down the options and find what will work best for you.
Okay. That sounds good.
Terrific.
Dr. Davis and I talked about ways we could prevent low blood sugars. We talked about changing the dose or type of insulin I use and how and when I use it. He explained my options and we talked about it. And he gave me the chance to talk about what was important to me. But it wasn't just Dr. Davis. I worked with my whole team to come up with a plan that works for me.
Claire, we made some changes to Jim's treatment plan. Would you help him explore more ways to prevent and treat his low blood sugars? You know, he seemed surprised when I told him I wanted him to share in formulating his treatment plan.
Sure, Dr. Davis. We'll work together to make sure he understands his plan and all his options and what he can do to prevent these low blood sugars.
Excellent. Thank you.
We'll go over everything you and Dr. Davis decided on in a minute, but I want you to know how important it is that we know everything we can about your low blood sugars. We need to share our ideas in order to find the best solution for you. In fact, share is a great way to work together. When we share, we seek your participation in your healthcare, help explore your options for treatment, assess your values and preferences, reach a decision together, and evaluate how your treatment plan is working for you. If we all follow these steps to find what works best for you, then we can work together to prevent low blood sugars.
Thanks, Claire. You know, it's nice to share my goals and concerns with you and feel included in the decision.
Well, Jim, since you're living with diabetes, sharing what's important to you is always the best plan.
By the time I left the office, I felt like we were all on the same page about treating my low blood sugar episodes. I learned a lot when I started asking questions, and now I feel great. You know, it kind of surprised me when they asked me to help in making treatment decisions. But it is my health, right? Talking about it together and considering what options work best for me just makes sense, and I don't feel like I'm just being told what to do. So speak up and share your goals and concerns. And keep the conversation moving by discussing with your healthcare team to make the right choices together.